So tell me about cellulite. Why do we seem to get more of it as we age? Or do we get more of it?
Well, I mean, cellulite is very common, more common in women than men. Basically, cellulite is when the subcutaneous fat, which is kept in little compartments surrounded by connective tissue, just bulges slightly into the dermis, and then you can see a little bump, and we know the typical orange peel surface that we get with cellulite. It's a bulging of that subcutaneous tissue that we're seeing. So as we get older, collagen and connective tissue starts to weaken and degenerate a little bit and allows that bulging a little bit more. So that's probably part of the reason. Getting a little bit more body fat is probably another reason, you know, and we don't really know, but you know, a little bit more body fat just allows those fat cells to be under a little bit more pressure. So yes, as we get heavier, that can also contribute to more. Some people say hormones play an effect. Again, we don't have any direct evidence about that, but it probably plays a part. But the reason that women have more than men is possibly not just due to hormones, but also due to the thickness of the skin. So men tend to have thicker skin, so that little bulging fat isn't going to be seen as.
And also they have it on different parts of their body, because the big problem with the patients that come here, what's the main areas they get concerned about?
With cellulite, it's the legs and the thighs. That's nearly always where most people have.
And what about so in terms of other fat areas, that it's the belly? Is it tummy? What is it?
That's about
muffin top.
Yes, that's more about removing fat than cellulite, which is the same thing, really. I mean, when you're treating cellulite, you're just treating fat at a more superficial level.
Right, I see.
So it's the effect is that you're getting rid of, or not getting rid of, but reducing the cellulite. And if we're targeting fat at a deeper level, then we're reducing the fat in that area. So when you're talking about abdomens and you're talking about muffin tops, they're areas where we would treat the fat at a deeper level than when we're treating cellulite, for example, which is more superficial.
Okay. So one of the things I've noticed as I age is that I've got these weird knees, and I've started doing yoga, and when I do downward dog, my knees come with me, like as in the fat hangs down, which I find really disconcerting, and then my belly's coming down as well. I don't even have a belly and it's still hanging down. So that's what I find. I'm just trying to look at the back of my legs. So I'm just thinking, how, you know, can you do anything about the nana knees? You know, and pull them up a bit and stick them back onto the legs. That's what I'm interested in.
To a degree, I mean, there's no miracle, but you can certainly smooth that area. You can decrease a little bit of fat. Some people do get little fatty collections and around the upper knee, and with the Med Contour machine, you can actually go over that area and improve it a little bit. It's not going to completely get rid of it, and it's not going to completely stop, you know, forward movement of the tissues. You know,
is that what it's called?
Well, it's everybody. It doesn't matter how old you be, you'll see some of that.
God, now what do you know about the others? Because I know that in terms of technologies, the three key ones seeming to be promoted out there are cryolipolysis, radio frequency, and ultrasound, or cavitation ultrasound. So can you explain the difference? So tell me about cryolipolysis.
Okay, cryolipolysis is basically where the fat tissue is frozen. So the device has like a suction head that's placed over the lump of fat that you're trying to treat. It's sucked into the head of this machine, and then it's reduced. The temperature is reduced. It becomes numb. The temperature gets to such a level that it actually kills the fat cells. And then after the treatment is finished, very slowly the tissues eliminate the debris that comes out of the fat cells. And
how does it take for it to eliminate?
In the case of cryolipolysis, it's probably weeks to months when people see their best results. So often they only need one treatment, sometimes more, but it takes a little while to see the benefit. So the benefit is that you do just have one single treatment. But it is a little bit restricted in that you're just treating one pocket, so you have less of the smoothing effect of some of the other technologies. So it's useful for abdomens and thighs and where you can get the cup over the lump of fat.
Oh, nice.
Yes.
So what about now with cavitation ultrasound?
Yes.
How does that work?
Well, basically, cavitation ultrasound is a technology where the ultrasound is emitted into the tissues, and it will stimulate just the fat cells and cause some vibration within the fat cells, which will result in the rupture of the cell membrane. So you get release of the fatty liquids into the interstitial tissues, and then with normal lymphatic drainage and vascular supply, that fatty liquid is then removed from that area, taken back to the liver for processing.
Right.
So it removes the fat in that immediate area.
Right.
So you can treat over any area that you can get the head of the machine over.
Right.
So the advantage is that you can also program that at different levels. As we mentioned before with the cellulite, it can be more superficial,
Right.
or if you've got a deeper area of fat, you can program it to be treating at a slightly deeper level.
And how many treatments do you typically need with ultrasound?
It really does depend on the individual and how much what you're trying to achieve, but we generally say 4 to 6 treatments is sort of a minimum of treatments.
Okay. And lastly, what about radio frequency? That seems to be has got as strong evidence as ultrasound or cryolipolysis?
I think that is a more recent
Is it?
addition to the treatments, at least here in Australia. But it, and I know less about that than I do about the other treatments, but it has probably a little bit more of a benefit when it comes to skin tightening.
Right.
But with the radio frequency, it certainly has an effect on heating the fat cells. So it works slightly differently to ultrasound, but it still heats the fat cells and results in their rupture.
Right.
And then by the same mechanism, the fatty liquids are taken away.
So why did you choose cavitation ultrasound?
Okay. Well, the particular machine that we chose has 2 transmitters, and they are angled toward each other in a head that actually has a vacuum attached. So the skin is sucked up into the head of the machine, and the 2 transmitters working at an angle can focus the ultrasound at whichever level we want. So we have a little bit more control, as I said before, about treating different levels. So it's useful for cellulite, it's useful for fat. You can move it over areas and get a smoother effect. So it helps with smoothing out little irregularities and if there are little pockets of fat or little bits of fat that just hang over a little bit, again, you can use that and smooth that out, and you can you get probably a better treatment by being able to focus the ultrasound a little bit better.
Right, okay.
It's more that it's adaptable to using it in different scenarios. We felt would be more.
So the versatility, right. And in terms of pain comparison between, say, cryolipolysis or ultrasound, are they comparable in terms of pain?
I think they probably are comparable.
Yeah.
I haven't had a cryolipolysis myself, but they're not generally a painful thing to have. Med-Contour occasionally gives very minor discomfort, but it's not a painful treatment at all.
Right,
So.
okay. And who won't they work for? Do you, particularly with, because I guess you've got the ideal patient for any of these treatments. What's the ideal for, say, freezing versus ultrasound? Or are they exchangeable?
Well, again, the ideal patient is not an overweight patient. I mean, basically, it's important to note that this isn't a weight loss tool.
Yeah.
It's not about losing weight at all. It's for people that have a little stubborn pocket of fat somewhere, and and they diet and they exercise, and it just stays there. And for some people it might be around their abdomen, or it might be on their upper thighs or their inner thighs, and no matter what they do they can't seem to change it. So it's about contouring the body, not about fat loss. And I think that's where Med Contour helps a little bit more, because it has a more generalised effect in helping to smooth and even out irregularities. And you're not just treating an isolated pocket, leaving the surrounding tissue untreated. You're treating the area in a more generalised way.
Right. Tell us about the cost of something like ultrasound Med Contour.
Well, it depends on the area that is being treated, and that's how the cost is calculated. But generally speaking, to treat an abdomen is about $200 per treatment.
Right.
When people, we have packages, and if they purchase a package up front, then it will become less than that. When we're doing 2 legs, then that can be $300 or $400 a treatment. Again, we need to see the individual, because obviously some people we're talking about a very small area, and some people we're talking about a much larger area. So we always give a quote. And then you need to have that treatment 4 to 6 times.